Now, amidst a rise in coronavirus infections in some parts of the country, the central government has asked Delhi and 6 states to ensure adequate testing and promote COVID-appropriate behaviour and increase the pace of vaccination to contain the surge. In a letter to Delhi, Kerala, Karnataka, Maharashtra, Odisha, Tamil Nadu, Telangana, the Union Health Secretary Rajesh Bhushan has said that the upcoming festivals and mass congregations in different parts of the country may have the potential to transmit infectious diseases, including COVID-19. Akshay Dongre is now joining us with more details. Akshay, many people are going in for home testing, or just when the symptoms appear, they go in for isolation, some without even testing. Is that a cause of concern? Does the government believe that having exact numbers through perhaps RT-PCR tests will help them better take care of the situation? Is that the sense that you're getting?
Well, absolutely. As far as the number of COVID-19 cases are concerned, we are witnessing a rise once again in states like Delhi, Telangana, and in the 7 states where the central government has now written to the state health secretaries. The motive behind these letters is because the number of cases, while they are low from the ones that we have seen in the month of January in the earlier waves as well, but still the government doesn't want to take any chances as far as COVID cases are concerned, because there is a rise of about 10 to 12% in the national capital. In the neighboring areas as well, the number of COVID cases usually rise as soon as the number of cases start rising in Delhi. In other states as well, there is a rise in the number of cases, and that's why the government has written to ensure that there is genome sequencing in the labs across country, in the labs that are recognized by the INSACOG. There should be testing. The state government should ensure adequate number of testing. Vaccination should be boosted, and especially at this point of time in this season, when influenza-like sicknesses are usually at an all-time high, people confuse it with COVID, or people confuse COVID with influenza-like diseases, and that's why many of them don't even get tested. As far as the home isolation, or rather home testing at home is concerned, yes, initially doctors are saying that initially when Omicron cases were on the rise, then the rapid test that was done at home was helpful for people. But now many a times rapid test does not give an accurate result, and that's why people, even if they are tested negative in the home test, they should always go for an RT-PCR test to ensure that they do not in fact infect other people as well in their family or at their workplaces. And if they are tested positive, they should immediately isolate themselves. The other things that have been told by the central government is that the upcoming season will be of festivals, and a lot of people usually move from one place to another. There are crowding in the markets, and that's what needs to be monitored. Clusters should be monitored. The number of positivity rates, that should be monitored as well, to ensure that while the number of cases are low right now, are not that high right now, it should remain the same. And gradually, the government plans to boost vaccination across the country, especially the precaution dose that also has been made free till 15th of August.
Akshay, what about the hospitalizations? Despite the fact that we are seeing the numbers rise, as you're pointing out, has the hospitalization remained low, and shall we take some sort of solace from that?
Well, hospitalization is low because a lot of people who are testing positive, these are breakthrough infections. People have already tested positive. Most of these people have already tested positive in the past, or they have gotten 2 doses of vaccine. So the severity of the disease remains low. But a danger is still there for those who are above the age of 60, people with comorbidities. They are still in the risk category. And that's why, even though the severity for a normal person remains low, the person's infection, if it increases, it can definitely risk those who have comorbidities or those who are over the age of 60. So that is one point the government is also stressing upon.